Hey there, Startup Nation. Welcome back to another episode of Level Up, where we help you work with the clients you love and grow your dream practice. And we continue to bring you topics related to COVID specifically for you guys. And I see a lot of things, a lot of unease, discomfort, questions, not clarity of when is it the right time to transition back into the office and what things to consider.
But first, before we dive into our topic today, let's thank TherapyNotes for sponsoring this series. They're an amazing EHR, and we're so grateful for all that they do to support clinicians and for our relationship with them, being able to provide you guys content like this on an ongoing basis. So if you want to take advantage of their amazing platform, definitely check them out. You can get your first 2 months for free with code PPS, as in Private Practice Startup. Just visit therapynotes.com, and we'll put the link for you in the information and resources.
And if this is your first time with us, we are Kate and Katie of the Private Practice Startup. So let's dive into today's topic. So there is a lot to consider, and we actually have some really great resources for you. And I'm going to give kudos to Kate for this because she actually found that the APA, so the American Psychological Association, has created an informed consent for clients to review and sign. But it's a great guideline to understand what it is that you guys need to do to transition back into in-office sessions. One thing that we really want to encourage you to do is first and foremost is you have to get clear and communicate clearly to your clients the policies, the procedures, and the protocols. So your role as a leader right now is extremely important because when you're clear and you communicate clearly, you're going to make the client feel much more comfortable. And there's a lot of actually other things to consider. And even though we've been essential since this whole thing has started, most of us have moved to telehealth. And the reality is, we want to also be mindful of the fact that there are many of you that are in very, rural areas and maybe have not been affected the way that other areas have been. So, we're kind of speaking to both parties and as we talk about this topic today.
Yeah, there's really a lot of factors that contribute towards your decision. It is a personal decision. It's a clinical decision. There's so many different factors that really play a part. And Katie and I feel very strongly about having a community that is safe and non-judgmental when it comes to whatever the right decision is for you and your practice in terms of the decision to start seeing clients in person, or whether you've continued to see a portion of them or all of them in person, or you've transitioned completely to online. There's so many factors that play a part in that. And we just want to make sure that you guys feel comfortable and safe knowing that this is a judgment-free zone. And we want to support you in that and also give you more information to really think about the decisions that you do need to make, because Katie did say just a moment ago that the mental health profession has been deemed an essential business. And so a lot of mental health practices have continued to remain open, of course, having very strict policies and procedures in place. And it is more important than ever for you to take charge as the leader, like Katie was talking about, of your private practice. If you have a group practice, you've got to take leadership for your team as well, because they're looking to you for guidance. And I know I can speak from that personally because our team at Bayview Therapy is looking to me as the leader to let them know how we're navigating the very difficult time of the COVID-19 virus pandemic. And that has affected so many people's lives and practices and families in so many different ways. And I just sent an email out to the team yesterday talking about, here's all the protocol that we are doing and to ensure that our office stays healthy and as safe as possible for those that are continuing to see a small portion of their clients in office. Most of the team has transitioned to telehealth, and we talk about what those policies and procedures are for telehealth, how to determine whether someone's appropriate for telehealth or in office. There's just so many factors to consider there, because not everybody's appropriate for telehealth. Not every service is able to be provided through telehealth. So there's just a lot of things to consider, and you want to make sure that you're thinking about it from all of the different perspectives. So from the group practice standpoint, as a group practice leader and owner and founder, it's been very important to speak very clearly to the team so they know exactly what the protocols are, exactly what to expect, and they know how to handle that with their own clients and how to assess, and just to make sure that we're all on the same page, right, as we're going through this together. And then the resource that we're providing with the APA informed consent is awesome, because it actually gives a lot of examples about the types of protocol that you can take to ensure that you're doing everything you possibly can to keep those in-office sessions as safe and as healthy as possible for you, for your clients, for anybody else that may be coming in and out of the office. It also talks about the potential for lack of confidentiality or a breach of confidentiality if you somehow contract COVID or your client contracts it and you didn't know they exposed you, and then you saw the rest of your clients, you accidentally exposed them, then you have a legal obligation to report that information to your local authorities. And that obviously would be the sharing of your client's name. And so there's that breach, but it's not really a breach. You just have to make sure that your clients are aware of that. And it makes it a whole lot easier if you can get their informed consent. You're required and obligated to make that notification if they were to test positive to your local authorities regardless, but it is best practices. And you want to make sure that your clients are aware of that. So we're going to put the link in the resources.
Yeah, and you definitely want to get their written and informed consent. And Kate and I talk about the relationship with paperwork is that a relationship with paper like creates a conversation, right? And so here we're in a place that we've never navigated before, and the APA did a great job of really outlining some guidelines for us and utilizing the informed consent for this specific situation to have a conversation and to review it with them and have them sign it and have them ask any questions that they need to have. So yeah, so this is a different place where we would have to break confidentiality to report this information to the CDC. So let's kind of review some things that you would want to consider really in reducing the exposure to yourself and or your clients. If they do, if you do decide to maintain telehealth, is communicate that to your clients and stand firm on that. If that is your decision, knowing that you might lose some clients, but also being able to refer out for therapists who might be seeing in-office clients. It's really important. You can also let your clients know. I shared with one of my clients who asked, when can we get back in office? And I wasn't ready yet. This was 2 weeks ago. And I said, we're going to still do online if you still want to do that. I understand, right? Validate that you want to come back in office, but at this time, I'm not really sure. And I'm not sure what's going to be happening as we reopen. So I'm going to let you know in 2 weeks. Let's check back in 2 weeks. And obviously there's a lot of great information coming out. So some of the things that's really important, some of the stuff that you guys are seeing already right now is you want to implement that into your practice, right? Not coming into the office if you're sick, having the option to do telehealth if they're not well, you could do that as well. Assuring that they're taking safety measures. One of the things that we talked about in the practice that I'm in is that clients would stay in their car, not even come into the waiting room, and the therapist would call them when the therapist is ready. If you do have a lobby, you want to position those chairs, of course, 6 feet apart, assure that folks are wearing masks, right? So here's a really interesting thing. If you want to assure that they're wearing masks to, be appropriate during these times, how is that going to affect your treatment? I know for me, of course, I wear a mask when I go out, but I hate wearing the mask. I can barely breathe and you can't see anybody smile anymore. But how is that then going to affect therapy? Because so much of our work is cueing into the nonverbal. And are you as a therapist going to feel comfortable wearing a mask for 4, 5, 6 hours? I don't know. So that's something that you also have to consider as well. Kate, what are some of the things that you've noticed too?
Yeah, and those conversations about whether to wear a mask for the therapist, for the client, and where they would wear the mask, whether they're just wearing it while they're in your office suite and they take it off if you decide to take it off, or whether they wear it the entire session. Those are individual and very clinical decisions that you need to make, because it does block your ability to see the client's affect. Sometimes you can't understand what a person is wearing when they have the mask because they're not talking loud enough. So you might have to ask them to repeat. And like Katie said, they're not really that comfortable. However, it does provide significant benefits in terms of health, right? And it's a safety measure. So you really have to weigh the pros and the cons there and talk about it. You might decide to do it with some clients and not others. And also looking at other factors as well. How low risk are they? How high risk are they? Do they have other pre-existing health conditions? Do you have pre-existing health conditions? Do you have someone in your family that's staying with you that if they were exposed, it could be deadly to them? So those are the different types of factors that really play a part in those types of decisions that we make. Making sure that you have hand sanitizer accessible in every therapy room, also in your lobby, outside of your lobby, making sure that Everybody is washing hands. If you have a hand washing station, awesome, that's great. Or if you have the bathroom that people can go to, there's so many different factors that can really help to reduce the risk of exposure here. And then also looking at external factors. Has the person been traveling? Have you been traveling? Are they in a high risk job where they might be around other people who could be exposed? So just looking at all of those different factors, and really, when you think about it, there's a lot of complicated factors to seeing people in office, right? And then making sure you're sanitizing and disinfecting in between sessions, cleaning the office heavily in the morning and in the evening. I know our client care coordinator, she comes into the office at 6 a.m. each day and does a huge disinfection of the office. And there's only very select few clients and therapists who are meeting at the office. Most everybody on our team is telehealth, but even just for that, it's serious, and you have to take it seriously and make sure you're doing everything you possibly can. To see clients in office right now is a lot of extra work, and that can be stressful because already when you have clients and you have a busy schedule, it's hard enough to keep track of notes and those other responsibilities that you have normally. Right now, to add all of this extra cleaning and disinfecting and staggering your sessions so that they're not back to back, leaving you enough time, it's a lot of work to see someone face to face. But sometimes, depending on what population you're working with or what service you're providing, it might be unavoidable. So,
right. And another thing to consider, and again, have a conversation about, I know for me, I'm really missing hugging my friends and people that I see. Like, it's just a natural instinct. And so, as a therapist, many times we'll shake a hand, or sometimes clients want to give us a hug, right? And it's important, even though we're all in this together, and people know that, is just to even have that communication. Like, I know I usually give a hug at the end of the session, or a client does, but we can't do that. Or, please excuse, I won't be shaking your hand when you come in or when you leave. I know that's something that we usually do. But again, it's nothing. It's just, we're just trying to keep you safe. So these are all things that you need to think about and begin to navigate. Like Kate said, we're going to go ahead and share this link because it is so valuable. We'll share it in the notes, the resources, and everything like that. Kate, any other final thoughts or anything else that you wanted to share that folks should consider as they transition back?
I mean, I just think it's been amazing to see our community locally, and then our Startup Nation community as well. Everybody really thinking through about how to flatten the curve, being smart, being safe. For so many people have been sheltering in place. I know I have since March 13th. And it's all of the collective decisions that we've made during this very difficult time where there's so much unknown and so much stress and anxiety. It has really been working to help flatten the curve. And so I just want to acknowledge what each one of you are doing to help participate in that and make the global changes that are happening, because it really has been working. And as you slowly consider transitioning back to the office or seeing more clients in the office, whenever you decide to do that, just make sure you're continuing to do so in a way that you're keeping your safety and your client's safety as top priority, your family's safety, because nothing's more important than your health, and you would never want to jeopardize that. So yeah, I just wanted to acknowledge what everybody is doing, because it is quite powerful to see that.
Yeah. And I would also encourage you guys, look over this information, listen to what we've said. And if you're not fully clear for yourself, is talk through it with some trusted colleagues so you can get really clear. And I would also kind of talk through how you're going to handle when clients are like, no, I don't want to continue unless I see you in office. So can we do that? And if you're not in that place, like, how are you going to address that? Again, what's most important in leadership is being really clear and standing by what it is that you're saying. Of course, you can always reevaluate in 2 weeks, 4 weeks, 6 weeks, wherever you are. But, just being really clear and communicating that, and also validating and understanding their concerns. So we really appreciate you guys. Like Kate has said, if you do have a question for us, look for the Tuesday Ask Us post in our Facebook group. I always feel like that's so much to say, like a tongue twister, and we will be glad to answer your question there, but also create a video out of it. So remember, Startup Nation, you got this. We're in this together, and we will see you guys next week for another level up. Take care, everybody.
You guys got this. Stay safe in the meantime and healthy, and we'll see you next week.
Take care.